Do you wake up in the morning feeling kind of like the Tin Man? Creaky, painful, stiff joints? Movement feels a little extra hard? You might even feel achier when it rains or gets cold. If this sounds like you might have arthritis. You and 58 million other US adults. I'm Jordan Thompson with The Perfect Workout, and today we're going to discuss the impact arthritis has on joints and how strength training can improve the quality of life for those who deal with this particular disease. Let's dive in. So what is arthritis? Simply put, arthritis is inflammation of the joints. And those who have arthritis commonly experience these symptoms: pain, stiffness, decreased range of motion, and swelling. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis is the breakdown of joints to the extent where movement becomes painful. In the case of the knees specifically, arthritis typically occurs when the padding between the upper and lower leg, or upper bones, the femur and the tibia, is partially or completely worn out, allowing for direct bone-on-bone contact. The wear and tear can ultimately lead to chronic pain, uneven walking or altered gait, compromised mobility, and disability. Unfortunately, osteoarthritis has become so common that it's pretty synonymous with aging in general. In fact, over 22 million Americans between the ages of 25 and 74 have moderate to severe osteoarthritis. It can develop as a result of chronic overuse, like knees of a long-time runner, or past injuries, especially like fractures and ACL tears, or chronically incorrect movement patterns, like maybe having bowed legs. Rheumatoid arthritis is a chronic inflammatory disorder that affects more than just your joints. In some people, this condition can damage a wide variety of the body systems, including the skin, the eyes, lungs, heart, and even blood vessels. Unlike osteoarthritis, rheumatoid arthritis isn't caused by wear and tear. It's actually an autoimmune disease that occurs when the immune system is triggered and the body attacks itself, affecting the lining of the joints most specifically. The results of RA can also cause more extreme issues such as joint deformity and even bone erosion. Now, I just mentioned some kind of scary sounding stuff, but we want to think of arthritis as a spectrum when looking at the symptom, the treatments, and the results. According to the CDC, 49.6% of seniors have diagnosed arthritis. Now, some people can live easily with their day-to-day activities with really no issues. The arthritis is more of an inconvenience, whereas others have, life-changing events and debilitating pain as a result of the disease. So there's a lot of in between. So for the sake of being educated, let's talk a little bit about some of the dangers of arthritis. The first one is joint replacement surgery. Although surgery isn't the first step in treating arthritis, it is really common as like a final step for older adults and those who have years of damage to their joints. The hip joint, for example, is one of the most common sites for arthritis. It's especially common for people who have experienced years of more than normal force on the joint. And these people are those who typically have a background in athletics, dance, distance running, or those who have been obese. With arthritis, people lose hip mobility and the joint ultimately starts to feel tight and stiff and painful, and about a third of the people who have hip arthritis do end up getting a joint replacement. The next danger is living with pain. The Arthritis Foundation says many people who have arthritis or related disease may be living with chronic pain. Pain is chronic when it lasts 3 to 6 months or longer, but arthritis pain can last a lifetime. It may be constant or it may come and go. So someone with a less severe form of arthritis might carry heavy groceries without issues. But someone with severe arthritis and chronic pain may experience tremendous elbow pain and need to take lighter loads or get assistance to alleviate that burden on their elbow. And the Mayo Clinic states that destructive mind-body interactions, including depression, can be a result of living with pain of arthritis if it's left untreated. And with chronic pain can bring on another danger, and that's losing independence. About 1 in every 14 seniors requires personal care assistance, according to the CDC. About 1 in every 6 adults ages 85 years or older are living in a nursing home. The loss of independence is due to a few factors, and arthritis is one of them. Being a prevalent source of pain, arthritis can limit physical abilities like walking up the stairs, washing your hair, carrying groceries, and it could just lead to relying on others more and more. Strength is one of the biggest factors in determining how well we can physically function. The diagnosis of arthritis is not a guarantee of future disability. Lifestyle habits play a key role here too. Unfortunately, you do have a say in how and if the disease progresses. With that in mind, let's dive deeper into the research to see how strength training in particular can help. Men and women 55 years or older with knee arthritis participated in a 4-month strength training study. The program featured 2 workouts per week using lower body exercises like the leg press, the leg curl, leg extension. After starting with 3 weeks of easy to moderately challenging weights, the program featured relatively challenging resistance on the exercises. As you would expect, the 4-month program was effective in increasing strength. The arthritic knees became 71% stronger. Pain and function improved significantly. Pain decreased 41%, while function increased 44%. With less pain and an improved ability to use their knees, you can imagine the participating men and women were really happy with their results. A second study looked at strength training with women over a 6-month span. The women also used challenging weight loads, but this time slower repetition speeds, like 6 to 9 seconds per rep, were implemented. The exercises were all lower body based: leg press, calf raises, leg curls, leg extensions, hip abduction, and hip adduction. And the results of this study showed that these women improved their leg strength, reduced their arthritic pain, improved their leg function, and the rate of disability among the women decreased. Let's talk a little bit more about rheumatoid arthritis and strength training. Many RA patients are less physically active than their healthy counterparts. However, strength training will not worsen RA. In fact, experts and physicians overwhelmingly recommend it. An increase in strength means the muscles can better support your joints. Additionally, RA can accelerate sarcopenia, which is the loss of muscle mass with age, which in turn accelerates the loss of bone mass. It is especially important then for individuals with this condition to participate in regular, safe, effective strength training, like at the Perfect Workout, to prevent both muscle and bone loss. So now we know strength training helps arthritis. Now what? If you struggle with arthritis symptoms, we suggest performing regular high-intensity slow-motion strength training workouts 1 to 2 times per week. At the Perfect Workout, our trainers are certified in our super slow method to ensure that each workout is tailored specifically to your needs while providing the absolute safest method of resistance training. Our method's enhanced safety is due to the slow movement, which minimizes the force produced on your joints and maximizes the muscular effort at the same time. This muscular challenge results in the body adapting with increased muscular strength. Simply put, you don't have to accept arthritis as the end to high quality life or the activities that you enjoy. Effective strength training improves the strength of the muscles, supporting the joint, and reduces arthritic pain, and helps to prevent future disability. If you'd like to learn more about our method of strength training, head on over to theperfectworkout.com, where you can read all about our methodology, our member success stories, and book a free introductory session.